much. Okay. All right. I'm going to go ahead and jump into the presentation. So this is the Heart Health Blueprint, how to calm inflammation, restore metabolic health, and build a resilient heart naturally. All right. See if I can get to my presenter view. All right, so we're going to talk about why cholesterol is not the full story. It has been sort of blamed for, largely for heart disease for many decades now. And really, there is not the science to back that up. It's just that there is a pill for it. And when there's an easy pill for something, then that tends to be where we focus in the Western medicine model for chronic disease. We're going to talk about how the gut, our hormones, our liver and nervous system affect the heart and the actionable steps that we can take. And then I'll also be talking about how I can help. So as with any webinar, I want to make sure that you take away some valuable tips and things that you can put into practice right away. However, information only gets you so far. It's the implementation that often needs support, and we're all different. And so I really embrace the concept that we do need to take what we call a bio-individual approach to anything that we're trying to establish for our health. And so that's why I went into functional medicine, because it is an individualized approach. So I'm Angie Gallagher. I am a functional medicine wellness coach and a former cardiac rehab clinician for 25 years. So I'm here to help you understand what truly drives vascular disease and risk for heart attack, for stroke, for peripheral vascular disease, and even dementia, and how we can optimize our vascular and our overall health so that we're not just surviving, but we're thriving late into life. Heart disease is still the #1 cause of death, but we're asking the wrong questions. So most people are just told your cholesterol is high, here's your statin, or reduce your sodium intake. But there's very often the conversation is not had about why inflammation is present, why the blood pressure is rising, and why the heart is under strain in the first place. So why do this work? I had so many years in cardiac rehab where patients were coming back and they were compliant. They were compliant with their medications. They were compliant with many of the things that we were trying to teach them in cardiac rehab, but they were coming back after second and third cardiac events. And so seeing people doing everything right and still struggling, I just wasn't okay with that. I mean, sure, it was job security for me in cardiac rehab, but there was like something about this is not sitting right. And what I learned in my functional medicine training is that you can't out-exercise or out-medicate a dysregulated metabolism, chronic inflammation, oxidative stress, or nervous system dysregulation. So I didn't leave cardiac rehab because I didn't believe in what we were doing, but I wanted to address the true drivers of cardiovascular disease, which weren't being addressed there. Okay, so the fire, this is what I like to say oftentimes when I'm trying to explain, heart disease and cholesterol. The fire didn't start the fire. So cholesterol is a responder to damage in the body, not the cause of the damage. So is cholesterol involved in heart disease? Yes. But what is causing the damage to begin with is where we need to focus, and that is inflammation, glycation, oxidative stress, insulin resistance or poor metabolism, and nervous system dysregulation, meaning that we're stuck in our fight or flight and we're not able to get into that rest and digest parasympathetic side of our nervous system. So each of those things damages the lining of the artery called the endothelium, and cholesterol shows up to repair, thereby causing plaque buildup. So heart disease didn't start with your cholesterol numbers. It starts years earlier in metabolism, in the gut, in the nervous system, and in toxic burden and oxidative stress that damage the walls of your arteries. So this patient came to me after having a scare with a cardiac arrhythmia, and he learned all about how inflammation in his body was a trigger for his arrhythmia. So he says how he removed the garbage he ate from his life. He learned how to eat healthy whole foods. He lost a bunch of weight. And he feels much better and has much more confidence in his health going forward. So metabolic dysfunction in the heart. So blood sugar matters so much more than you have been told. It is one of the primary causes of cardiovascular disease and damage to the vessel wall. So it's insulin resistance. We're not responding well to the insulin that our pancreas is producing, which means that we're going to have an elevated A1C. We often have an associated elevation of triglycerides. We develop more visceral fat. That's the fat that's deep in the body and surrounding the organs. And we have more blood pressure variability. And each of these things directly damages the artery wall. So this patient or client came to me after having a stent. I think she also had a heart attack and she had a stent. And she found me through, I think through my social media page, because she was very, convinced that this is not just a take her cholesterol medication and everything is fine. She knew that there was more to the story. And so she went looking. She went looking for someone that could help her really understand how her diet affected her heart. And we had her wear a continuous glucose monitor, and she learned, and we had her do advanced testing. So she did testing that with me that hadn't been done by the regular doctor, but she had them order it so that it would be paid for by her insurance. And we got those numbers back, and it definitely showed that she had insulin resistance. So we worked on changing her diet. She got a continuous glucose monitor, and she learned all about how her food choices were making her insulin resistant. And she corrected all of that, and her numbers came back better. So she's been an ongoing client. She likes to do regular testing and meet with me so that I can help her understand her results so she can stay on top of everything. So the gut-heart axis, the gut and the heart, this is like my favorite slide, because most people, when they think of heart disease, they just go right to cholesterol, because that's what we're told. That's everything that we're told in the doctor's offices and pharmaceutical companies. And we're missing this really important key player in heart disease, and that is what's happening in your gut. So your gut is supposed to be this nice, tight, like it's supposed to have this wall, this intestinal wall that has specific permeability. It lets certain things through that are meant to get through, that our body's meant to absorb, and it doesn't allow other things through that should be just passed right on through and out in our stool. But when we have leaky gut, which means that the intestinal wall is now hyperpermeable, so there's like holes poked in the intestinal wall. And there are many things that can cause this. These are things that I go through in my program and help people understand, like, what is it that's causing your leaky gut? And when we heal the gut wall, part of my approach when I work with people is the 5R approach to gut healing. And this is a functional medicine protocol. So we remove anything that's causing leaky gut, which is then activating the immune system and causing that inflammation. We also end up with endotoxins, the bacteria that are meant to just remain in our gut wall or be passed out in our stool, cross through the gut barrier into our bloodstream, and that can go to our brain, that can go into our vascular beds and cause more damage. We can also have poor digestion where we're not breaking our food down well, and that's leading to nutrient deficiencies. It's also leading to bacterial buildup, things like small intestinal bacterial overgrowth, H. pylori, different bacterial problems that can also increase inflammation and gut problems. And then we also have the microbiome that can become impaired, or we can end up with lack of diversity. And this can also have a huge effect on cholesterol metabolism and our blood pressure. So many things happening in the gut that are correlated and directly affecting our heart health. So what else can be reversed when we heal the gut? So I have a client, and this is not him, this is a stock photo, but he is a golfer, and he came to me because he had a heart scare and had a stent put in his left anterior descending artery. And his wife convinced him that he needed to come to me because she was trying to get him to make all these changes, but he was kind of resistant to her and didn't really think that he needed to do all the things she was suggesting. And so she was like, we just need to get a third party. We just need to get somebody that's not as biased to help us understand what really needs to be done to reduce risk. So they came to me, and I had him do a gut healing protocol. So we removed the things that were potentially causing that gut issue. And lo and behold, his psoriasis went away. He didn't even tell me he had psoriasis when we first started working together. But it was pretty bad, and it would affect his ability to golf because it was really bad on his hands. And after a few weeks of following my protocol, we healed his gut, and his psoriasis almost entirely cleared up. We can also put other autoimmune conditions into remission, like rheumatoid arthritis. We can clear up IBS, chronic headaches, allergies, chronic fatigue, chronic pain, anxiety, depression, hormonal imbalances, toxicity issues, cognitive decline, and so much more. The gut is really the gateway to all health and all disease. So when people come to me For heart health, I promise them you're going to improve your heart health and reduce your cardiac risk, but you're going to see a lot of other things get better that you don't even expect. So, so coming back to the, all these root cause drivers. So stress is huge. And I know I'm going through this really quickly because I have a lot to cover today, but I don't want to minimize this really important driver for heart disease. I have, in my 25 years working in cardiac rehab, I had people who were, they came through our cardiac rehab program. They were thin, they were athletic, they didn't have high blood pressure, they weren't diabetic, they didn't smoke. They literally had no risk factors other than stress. And they had been through so much stress in the recent months that it was like they just had all of these are the things that stress is associated with. They had all this sympathetic dominance, which is causing problems with cortisol. So when we're sympathetic dominant, we have elevated levels of cortisol, which then cause downstream dysregulation of all of our other hormones. Then we also have blood pressure variability. And when our blood pressure is wildly erratic, that's also causing damage to the artery wall. That elevated cortisol is causing increase in blood sugar, which is damaging the artery wall. The stress can lead to arrhythmias, and arrhythmias can, they can be kind of benign at first, but the more that they develop, they can become more dangerous, or at least symptomatic. And then we have poor recovery. Our body does not heal or recover when we're in our fight or flight state. So a body in fight or flight is basically in survival mode. It is not in healing mode. So a calm nervous system is not optional for heart health. A calm nervous system is required for heart health. And we go over a lot of this in my Heart Health Reset program. So why an eat less, move more, and take the med approach is not enough. So one size fits all advice. And what I've learned in this functional medicine journey is that we are not one size fits all. We are all sitting in our own ecosystem. Our physiology is profoundly individual. And so we cannot have this one size fits all advice. We've got to look at what is going on in your physiology specifically. And that's where testing can be really helpful. I don't tell my clients that we have to test. It's not required to work with me. And many cases, people will get a lot better and feel a lot better without testing. But testing does let us know what's actually going on below the hood so that we can dial in our approach a little bit more, with a little bit more like granular focus, and knowing that we're doing the exact right thing for your physiology. There's really not a lot of bad that can happen. There's no bad that can happen with any functional medicine approach, but we can be even more effective when we know exactly what we're working with. So lab reference ranges in the mainstream versus functional can be completely different. You may have a blood sugar of 95, which falls into like a fasting blood sugar of 95, which falls into quote unquote normal in the Western medicine model, but that's a high normal. And in a functional medicine model, we're not happy with a fasting blood sugar that's above 90, because 5 more points and now you're pre-diabetic. So we look from a functional perspective, we look to optimize, we look to get things into ideal range versus hovering just below the range where you've now have a diagnosis. And then lack of lifestyle integration. We really focus on lifestyle, and diet is what really optimizes our overall heart health. I try to avoid over supplementation. I mean, there are supplements that can be really effective. I definitely have, my supplement regimen, but I don't believe that we want to just all of a sudden have like 20 supplements that people are trying to take. It's really about making sure you're getting whole, healthy, unprocessed foods. You're getting a wide variety of plant foods. You're getting clean proteins. And we talk all about this in my Heart Health Reset program. So it's all about really looking at what is going on at the root cause, not just a Band-Aid approach with putting you on a medication to lower blood pressure or lower cholesterol. So in functional medicine, we look from a different lens and we ask better questions. We ask, why is inflammation elevated? Why is your LDL oxidized? We look at, why is blood pressure high even with medication? Why is stress hitting some people harder than others? Maybe there's trauma involved, trauma from a childhood period of time. And what is causing weight loss resistance? Is it mitochondrial dysfunction? Is it toxic burden? We dive in. We don't just treat with a medication. So I'm going to talk about some steps that you can take today. We're going to go through this pretty quick because there's a lot of stuff to cover. So you might want to be ready with a pen and paper. You will get the recording for this as well. So don't worry about, if you can't get it all today, you can watch the replay. But there will be some practical hands-on strategies to start working on improving your health. We're going to start with food habits. So this is all stuff that I would be telling people in my program. So I want you to feel like you're walking away with some practical tools. So shortening your feeding window. So this is referred to as intermittent fasting. We are not meant to be in a constantly fed state. And many people have, you operate from this, this advice that we used to give decades ago. I remember giving it, in working in cardiac rehab. We need to eat every couple hours to keep our metabolism going. Do you remember that? Remember that? People used to say that. Oh yeah, make sure you eat every couple hours. In fact, that is absolutely wrong advice. We are not meant to be in a constantly fed state. We need to give our body plenty of time between meals, and ideally plenty of time between our last meal of the day and our first meal of the next day. So this is something that, again, needs to be individualized, but you can start by just saying, I'm going to try to have a 12-hour fasting window. So I'm going to try to quit eating at, say, 7 p.m. and make sure I don't eat anything again until 7 a.m. And many, for me, for a long time, I was eating up until I went to bed, snacking on chocolate and wine at 10 o'clock at night, and then eating again at 6 in the morning. So that was not very healthy. So this is a thing that you can kind of tiptoe your way in. Just start with, I'm going to just try to fast for 12 hours. And when that gets easy, maybe try to make it 13 or 14 hours. And when that gets easy, shoot for 15 or 16 hours, but don't do it every day. We encourage people to do intermittent fasting, maybe 4 or 5 days a week, and then have a couple days a week that you have 3 meals a day and have breakfast. For some people, we might even do like a full 24-hour fast once in a while. So fasting is something we cover in the program. Snacking is something that is just really not recommended anymore. So try to make sure you're getting good meals that fill you up, that have plenty of protein and healthy, carbs straight from nature and healthy fats, so that you're feeling full and satisfied and you don't need to snack in between meals. Limit or eliminate processed foods containing more than 5 ingredients. I skipped over wear a CGM. Continuous glucose monitors have a ton of value. I love, love, love them for people who just want to do they don't really want to do a whole big coaching program with me, but they know that they want to have some kind of data to understand their own body and their own physiology better. And so I do offer just kind of limited coaching packages where we just have the CGM and I help you navigate wearing it and understanding the data. Make sure you have 4 to 8 ounces of protein at every meal. So men need more than women, but mostly it's because they're heavier than women. We ideally need to have about 1 gram of protein for every pound of ideal body weight. And make sure that you're pairing your protein with a healthy fat, like from whole food, like nuts or seeds or avocado or olive oil. And then complex carbs from veggies and fruits. I call them nature's carbs. These are not carbs that are made with machinery. They exist in nature. And aim for at least 25 different plant foods per week. You can use your phone note to keep track of that, and then limit alcohol to 1 to 2 times per week or none at all. This is a code that you can use if you want to get one of those CGMs. Again, you can contact me and we can just set up like a 2 or 3 session coaching package to help you navigate how to use your CGM and how to get the most from it. But they are a really great wellness tool. I've had a lot of people just simply wearing the CGM and changing their diet according to things that made their blood sugar spike and lost weight almost effortlessly. This is what a healthy plate should look like. So you can see it's mostly veggies. About 1/4 of it is a healthy protein, and you've got some healthy fat in that salmon, and then you've got the avocado there, and then there's some quinoa. Really ideal looking plate. Stress management, huge. I mentioned earlier, we don't want to minimize the effects of stress. So some things you can start doing. Really important that we make time for downtime and relaxation. We are human beings, not human doings. We need to get out of the mindset of that we need to always be productive. We need to give ourselves this time for relaxation and downtime. we need to prioritize sleep. Many people think that they can just, function on 4 or 5 hours and then just, hit the gym and, be super productive. This will bite you in the butt, I promise. Lack of enough sleep is terrible for your nervous system, absolutely terrible. And it's also terrible for your metabolism. You will likely have high blood sugar if you are underslept. It also leads to increased risk for cognitive decline in your older years. Explore meditation. There's so many different ways to meditate. There's no one right way. You can find the way that works best for you. There's hundreds of meditation apps that you can get to guide you. Getting into nature regularly. You can see I chose my picture because not only is she meditating, but she's sitting on the ground. She's in a natural environment. She's grounded. She's getting natural light. I mean, that's just ideal. Breathing correctly. I have learned so much about how the way we breathe affects our nervous system. I have a breathwork coach that I refer people to, and she's incredible. I do her breathwork sessions myself every week, multiple times, and it has changed my life. Practicing daily gratitude. When you're in a state of gratitude, your physiology changes. And this is measured. This is not just woo-woo. This is absolutely scientifically proven that when we are in a state of gratitude, we are in a more relaxed state in our nervous system. Hug someone. That releases that oxytocin, which is such a great feel-good hormone. Setting boundaries and sticking to them. Consider HeartMath. I am a HeartMath practitioner. This is a wonderful tool that provides both biofeedback and an intervention to help you balance your nervous system and optimize your health. And then light therapy. This is another tool, and I can talk to you more about this separately if you're interested, but there are light therapy patches that actually rely on the body's own light, reflecting the body's light back to it. And there are patches that are directly meant to help you better manage stress and reduce tension in your life. It's pretty powerful what they do, really incredible. Physical movement habits. So moving your body a priority. Sometimes it takes us setting a little alarm that tells us every 45 minutes to stand up and just maybe walk to the bathroom or go get a drink of water. But we can sit for hours and hours if we don't make ourselves get up and move. So making moving your body a priority. If we were not meant to be moving, we would not have these amazing working arms and legs. Like, we need to move our body. If we don't move it, we lose it. Plan to exercise snacks. So this means that you are just taking 2 to 3 minutes a few times a day to do some kind of purposeful exercise. And this could be doing like body weight squats or sit to stands or lunges or wall push-ups or taking a brisk walk around the block. Anything that feels like it's planned movement. And even better if you're challenging your muscles a little bit, like maybe you have some elastic bands in your office and you can do some lunges or squats with the assistance of bands for a little bit more work, or you can do arm curls. So many ways you can use exercise bands. That's a whole nother webinar that I could do. 1 to 2 times a week of a more sustained moderate exercise, like going out and getting an hour-long hike a couple days a week. Ideally getting out into natural settings. This is really, really important for overall health. We've got to connect with nature. Challenge your muscles regularly. Muscle is the currency of longevity. We've got to challenge our muscles regularly. We've got to do things that maintain or build muscle. Trying new things, try a new dance class, go to, as a guest to a gym that one of your friends goes to and get a guest pass. Try different things. Sometimes novelty can be really helpful to, create more interest and excitement. Find an accountability buddy. I have a running buddy, and it's like a game changer for my ability to be consistent. Setting small, achievable goals and celebrating every effort. I don't care if it's 5 minutes, if it's 2 minutes, if you do something that's deliberate for moving your body, you need to celebrate that, because it's that positive energy that is going to keep you motivated. And then general lifestyle habits. So getting the right kind of light at the right time. So we need to get up in the morning and we need to get natural light in our eyes, ideally within a half hour of waking up. So if you can get up and get outside to sip your morning coffee or open a window and just get natural light. The early morning sunlight actually does a lot to stimulate different hormones and neurotransmitters in your brain and helps with the melatonin that's supposed to circulate at night. So natural light is really helpful. And then in the evening, we want to make sure that we're avoiding too much artificial light. So in the evening, you want to make sure to wear blue blocking glasses. I'm wearing mine right now. Blue blocking glasses will eliminate the artificial blue light from stimulating our retina and causing us to have a suppression of melatonin and a rise of cortisol in the evening when we don't want that to happen. We want our cortisol to drop and our melatonin to increase, but natural or artificial blue light will do the opposite, and it's not good for your sleep. Grounding to the earth, so connecting to the earth through gardening, hugging trees, going out and standing barefoot in your grass, walking on the beach with bare feet. Anytime you're connecting to the earth, you are grounding your body, and there's huge benefits to that, both anti-inflammatory and antioxidant. Practicing intentional gratitude, I'm saying it again, it's so important. Spending time with loved ones, being in community, and yes, pets count. Staying present and curious. When we're in a curious state, it's very hard to be in a stressed state. Curiosity is a great energy to be in because it's an openness instead of a closed off feeling. It creates openness and space in your life. Practicing self-awareness, and especially practicing when you are in a state of lack or when you're telling stories about yourself that are not helpful. You know, when people just, say, well, I'm just lazy and I don't like to exercise, I'm just lazy. That's a terrible story to keep telling yourself. Maybe you're not lazy, maybe you haven't found the thing that you enjoy. And so instead of saying I'm lazy, you say, I haven't yet found the type of movement that I enjoy, but I'm still looking for it and I'll find it. So many stories we tell about ourselves. I'm disorganized. I'm not, I'm trying to think of another good one. I'm not coming up with anything, but I used to tell that story all the time. I'm disorganized, and I've fixed all of that. I've become an organized person because I wanted to, and it's important to me. Love yourself. This is critical. This is like foundational to everything. If you don't love yourself, you will not find yourself worthy of effort, and you will continue to put yourself last and everybody else first because you don't see yourself as being worthy of your time and effort. And you are absolutely worthy of your time and effort to be healthy, and your health and your longevity and your thriving you deserve all of those things. Forgiveness is a great way to let go of negative energy that's bogging you down. Get away from all or nothing thinking. Black and white thinking usually doesn't get us very far. Be open. Be willing to look at different options. Allow for growth and change and evolution of yourself, and let go of what's no longer serving you. Sometimes it's those stories that we're telling about ourselves. So this is one of my clients who, he's the one, the golfer, he's the one that had so many health improvements. One of them being his psoriasis went away. So this is, you can see his testimonial on my Google page, but he lost over 40 pounds through significant changes in his diet. He says that he thought he had a good idea of what healthy eating was, but after going through my program, he learned that he really didn't. And so he says, thankfully, I've stayed with it. I feel significantly better and healthier, and it wasn't nearly as hard as he thought it was going to be. So he has total confidence in my knowledge and how to live a healthy lifestyle. And so this is a great testimonial, and he was just so great to work with. So the Heart Health Reset program is my step-by-step root cause approach to optimal health and optimal cardiovascular health. So it's a structured reset for the body and the cardiovascular system. And so it takes the education and then it supports the implementation so that you get results. It's one thing to have the education, but it's a whole other thing to have the coaching to implement. So this is designed for prevention and secondary prevention. So you might have high risk for cardiovascular disease, or you might have already been told you have cardiovascular disease. And either way, this program is going to be helpful, and it's definitely safe. There will be no doctor who will look at anything in my program and tell you anything I'm teaching you is not safe. Some people are able to reduce medications. Some people get off medications, but this, of course, is only done with physician oversight and your physician being on board. So where the healing begins, this Heart Health Reset, it's a step-by-step program, and it's designed to reduce the inflammation and support your artery health, stabilize blood sugar and improve energy, and reduce the insulin resistance I mentioned, balance cholesterol naturally. When you take away the damage that's happening in your body, then oftentimes your cholesterol will naturally lower because it's not elevating to go fix all the damage. And then we also reduce stress on the heart and body by teaching you ways to better manage stress. It's not about quick fixes or temporary changes. It's about giving your heart and your entire body the environment that they need to heal and thrive. So when you reset your heart health, you're going to feel more energized. You're going to be more clear-headed. You're going to have more resilience and feel more balanced in life. You're going to reduce your risk of further cardiac, or your first time or further cardiac disease, and a lot of other chronic conditions, as I mentioned. Gain a sustainable path to long-term health. And this isn't just about your heart. It's about creating a foundation for a healthier, more vibrant life all around. So are you ready to take the next step? You can join the Heart Health Reset and start transforming from the inside out. And just some examples of what we would cover in the program. So we'll talk about metabolic optimization. These are different modules that I cover. I have lots of modules in the program. And you have lifetime access to it. So you know that once you're enrolled, you will have lifetime access to come back and review things and get reminders. So metabolic health optimization, we're going to heal the gut. We're going to help you with mindset and identity evolution. We're going to help with identifying toxins and how to remove them. We're going to talk about exercise, sleep, and other self-care. Talk about fats and fibers and healthy fats and fibers, how much you should get. We'll talk about how the hormones and the heart are interrelated. We'll talk about functional lab testing, managing stress, and long-term sustainability. So when we talk about labs, it's labs through a functional lens. So we'll help you understand your numbers. So we're going to talk about the functional medicine reference ranges as opposed to the Western medicine. We'll talk about inflammation markers that have not been tested. We'll talk about lipids beyond the LDL. So the LDL is just a very shallow look at your overall cholesterol. We'll dive deeper and look at ApoB and Lp(a) and all these other letters that aren't going to make any sense to you right now. We'll talk about blood sugar patterns and look at what your labs are saying about your metabolic health. And then we can also look at nutrient deficiencies, which you may be doing a lot of things right, but you're not absorbing, or for whatever reason you are nutrient deficient, and that's a big part of why things aren't improving. And most of these lab values are very responsive to a functional approach, allowing you to see your progress. So who is this program for? This is for you if you have been, if you know like you have heart disease in your family and you really want to prevent it in your own health. You've maybe had a cardiac event or been told you have cardiovascular disease and you want deeper answers. Maybe you're on medications, but you want to improve your underlying health and those core driving factors. You're tired of fear-based advice. You want more clarity and confidence around your health, and you want to support your body's own ability to heal and to thrive. So what makes us different is it's built on knowledge that has been gained through decades working in cardiac rehab and functional medicine. I have gone down every rabbit hole. I have consumed every bit of knowledge. I have read as many books as I can. I am a seasoned functional medicine coach with a lot of experience clinically, and that is woven into every element of what I do in this program. There's education and empowerment. I want people to be able to go through my program and feel like they are empowered to have the best health and lifestyle going forward. I want this to be a sustainable program. This is based on the idea that the body is systems-based, not silo-based. The heart responds to so many other things, and the heart affects so many other things. The heart is not in a silo. It is affected by hormones. It's affected by gut. It's affected by your nervous system. So many things. It's a system that we need to identify and address as a system. It's designed for real life. It's not, this is like, we'll give you tips for how to weave these protocols into normal day-to-day life where you're working and you've got demands. It's honoring both Western and functional medicine. So I do want people to make sure that they're still working with their regular doctor. Their medications may still be really important that they take. I'm not telling anyone that they should go off of them. I want their doctor to be a partner with them on this journey. And this is action and implementation based. You're going to have a coach that, you know, helps you implement as you move through. So there's different options for experiencing the Heart Health Reset. So I've created it so that there's an option for everyone regardless of your resources. So I have a self-paced DIY option. I call it the Foundations, and it's best for people who are generally either generally healthy and just maybe have some risk factors, like they don't already have heart disease. They really want to focus on prevention, and they're highly self-motivated. This program is going to be more automated, and it's not going to have as much of the one-on-one contact, but there is the weekly group coaching and a private community. And then I have a higher touch support option, which includes one-on-one coaching. This is best for those who already have a cardiac diagnosis or had a cardiac scare, want more customization, more hand-holding, and more one-on-one coaching. So both groups will get the same education. All the modules are going to be in both groups. Both will get the group coaching, the private community, but there will be different levels of one-on-one guidance. So, are you ready to transform your heart health and your overall health? You can join the Heart Health Reset today and get personalized guidance and support, proven strategies to reduce your inflammation and improve your energy, and a community of like-minded individuals that are all on the same journey. So you can take that first step towards a healthier heart and a more vibrant life. And so your next steps would be to book a clarity call. This way we can eliminate any confusion, answer any questions, and help you, just, learn that you can take the frustration out of trying to figure it all out on your own. Get the results that you're looking for sooner rather than, trying to go down a bunch of different paths and not really getting the answers. Invest in your worry-free future so that you can live to your fullest. So I like to award people who are like, I'm ready, I'm an action taker, I'm going to do this. So if you want to do the Foundations program, this is the one that's more automated for people who maybe don't have an actual cardiac diagnosis, but are just really trying to reduce their risk, and they're pretty self-motivated and can do the automated program. I take $75 off the package. It's normally $497. So you can scan that QR code, and that will take you, and then you use the code ACTION. Use code ACTION to make sure that you get that $75 off. And then if you are thinking you need more of the one-on-one guidance with the coaching, you can scan here and use the code GUIDE-ME, all one word, no space, GUIDE-ME. And that will save you $500 off of the signature package, which is normally $24.97. So this is going to have, again, the one-on-one coaching to support the overall program and make sure that you're implementing it ideally and just supporting your long-term success with the program. And then obviously I'm here if you want to chat. You can book a free clarity call. You can scan this, or feel free to email me if you would like to, if that's easier for you. Angie@heartwellnesscoaching.com, and we can get a 20-minute clarity call on the books so you can answer any questions and make sure you know exactly what it's all about and how it can help you. So the journey's just beginning, and the best is definitely yet to come. This is my focus is helping people get to a place where they understand, or they truly believe that the best is yet to come, that their best years are still out in front of them, that they still have many more years of adventures and time with loved ones and lots of memories to make without the constant worry about their heart. So I'm going to stop sharing and come back to the webinar and answer any questions that you might have. You can go ahead, you can pop those into the Q&A if you have a question, or you can pop them into the chat, either way. And this recording, this will be sent out, the recording will be sent out. So if anything I went through it too fast, you'll definitely have the option to watch the replay and share it. You can share it with anybody. It'll be up on YouTube, so happy to have it be shared with anyone who might benefit from it. All right, so I'm not seeing any questions in the Q&A or the chat, so I will assume that means that you don't have any questions at this point, but you do know where to find me. Angie@heartwellnesscoaching.com is my email address. And if it would be easier for you to call me, you can always do that as well. And my phone number is 541-760-0830. So feel free to call. And with that, I will wish you a great rest of your day. Thank you for joining me, and we'll be in touch.